So we're now into our last 40 minutes, and we've actually now got our very last speakers session, and we've got Pollyanna Jones from King's College Hospital, and we've got Shahid Sardar from the Princess Alexandra Hospital, and we've still got 27 participants, the stalwarts, still going. So do you know what I'd love us to do? I'd love to make this like a really interactive session, just to show how how the kind of momentum's gone. And we've got two really great speakers here. So the first speaker, Pollyanna, has been the leader and the backbone of the hubby movements and change day that we've heard about quite a lot today. So if we can get Pollyanna on camera. Can you hear me, Pollyanna?
I don't have a camera. Sorry.
Okay, so we'll just do this verbally. So what we agreed was that I would interview Pollyanna, because I particularly want to ask Pollyanna about the history of the hubbies. So Pollyanna, tell us about the hubbies. Tell us where the idea came from, how it started, and how the hubbies came about.
Okay, so in the first year of Change Day, we came together as a group, and we learned so much about how to make a change and how to make a difference. But and for the second year, we really wanted to spread that learning and teach other people how to do it. And also, we realised in the first year that Change Day will never be successful unless you always have new people doing it. So we wanted to have some new people spreading the message. And luckily, through gathering some people from the first year and then meeting some other colleagues, we found some really excited people who wanted to make a difference and get involved and spread the message of Change Day. And that's really how Change Day came about.
Fantastic. So how did the hubbies work? How were they structured?
Okay, so the hubbies are structured in a really non-hierarchical way. We have key people looking after every region, and they have colleagues who work with them in that region to develop what they need to do and do the outreach work. They meet and direct what change they will do, as well as what they do in each region, and they teach each other lessons about how to do that. Their main working is through WhatsApp, 1 or 2 meetings a year, and then a weekly drop-in phone call. They also get coaching from people like me and Jeremy, who in turn get coaching from people like you, Helen, and Jackie on what to do and how to make change work.
So who are they? I mean, who's a typical hubby?
So a typical hubby is someone who leads care on the front line. They could be a manager, graduate trainee, a nurse, or a doctor at any level. Anyone can be a hubby, and I think when we came together, we realised that we were probably the most diverse junior group in the NHS to ever achieve a change. We had people from cleaners, senior doctors, consultants, nurses, healthcare assistants, we were mental health, we had a counsellor, someone from the council, we had a patient, and we had someone from every walk of life, and that's what made it so exciting, and we all connected on our shared purpose and helped each other have the motivation to make a difference.
Fantastic. So, we talk a lot in the kind of change and innovation world about the importance of diversity, and not just diversity in a kind of human resources, making sure that our workforce represents the local community way, which we think is really, really important, but diversity around the sense that if we want to get new insights and we want to get innovation, we need to work with really diverse groups of people. So what's your experience of that with the hubbies and just the sheer diversity of people that you have?
Well, I think it's massive diversity, and it's really being positive. It means that we can make sure change reaches everybody, and we can work with each other to think about how we can best tell different people and get different people involved and help different people connect up with change in a variety of ways. The diversity is massive, from people who not even started their careers and they're volunteering in the NHS before university, to people who've qualified as consultants and really senior in the system working together. And you need both sides. You need the junior people with fresh ideas, but also the senior people to listen to them to help them make the connections in the system to deliver the change they want.
So something I want to ask you. So I mean, the hubbies were amazing. I mean, they were so like energised and made things happen. How do the hubbies manage the very difficult path or balance between doing their hubby work voluntarily and doing day jobs?
I think that's been like the hardest part about being a hubby. But and there's been different strategies. Some hubbies have been lucky enough that they've taken what they do in their day job and then added to it with change days. So Molly, for example, wants to change day really largely in her trust, and Lydia with her paired learning work. Some of the hubbies have had to use annual leave, but most of the hubbies have done their work in evening and weekends. All of the tools are after working hours, and the passion energy has just been that they've managed to have that time. It doesn't take a lot of time to be a hubby. Different pressures at different times, but it's a real personal development opportunity, and the training and the learning that I've got from being a hubby has been so much bigger than any other thing I've done in my career. And I know I'm young in my career, but I've gone through the graduate scheme and lots of other leadership development programs, but this is where I've really managed to learn how to make a difference.
So I think it's fantastic. And, you know, like what strikes me, like when I look at the hubbies and the way in which that very talented, dynamic group of people are prepared to be volunteers and to spend their own time because they're passionate. I mean, how could we ignite that kind of passion and spirit of volunteerism across the NHS, you know, on a much bigger scale?
So I think it's about growing the group. I think it's about getting people who've done it and teaching other people how to spread that message. And how many people can we get to be hubbies? You can tell someone else, you can tell someone else. The teaching around a hubby is about you learn your shared narrative about the shared purpose and how to connect with other people. And then the first thing you go and do is teach that to somebody else. This is about passing on like a domino effect, and I think that's what will make it big. I think further down the line, we do need to think about how people interact, and millennials really interact well through social media. So it's just about recognising that how they can relate through social media and then inspiring different passion ideas. Not everyone who's a hubby has an idea of, I want to change dementia, or I want to change this, but they all want to make the NHS a better place.
Yeah.
And they all have the time and motivation to do that, which is really important.
Yeah, no, I can see that. And, you know, we're a small, discreet group that are left on this WebEx now, but there's some pretty senior clinical and managerial leaders that are listening in to our conversation. So you know, how can we take the spirit of the hubby, you know, in terms of the way that you and colleagues have been able to like unleash the passion? Okay, how can the leaders that are on the call here, how can they create the kind of spirit of the hubby in their own organisation? You know, what is it that we can do that you know isn't just hubbies, but it's lots of other people, you know, being as committed as the hubbies are, but in a local area for their own work. You know, how can other leaders create that spirit in their own localities?
I think you need to find a few people at first in your hospital who've got those values and that passion, and then enable them to connect with other people along that line. Just give them a couple of key points of permission. So tell them they can go and do it. Give them some space and freedom to do it and some coaching on it, and then just step back. And when they get a bit stuck and they come to you, they'll come to you with the questions. They'll say, oh, we need some more people, or can you help us connect with this and that? And it's about having that light touch and not setting too much direction, but being there when they need the support. So it's offering the coaching. And I think the main thing a leader can do is teaching that person how to tell a story, and teaching them how to tell a story in a way that can affect change. And then also showing them how the organisation works. There's the politics and there's the barriers. These hubbies aren't aware, which is amazing, but if a leader can just demonstrate and help them guide through where those little bits can be a bit challenging, that's really useful. Yeah,
brilliant. No, I think you know, I think that's there's so much wisdom in that. So, you know, you and I have been part of conversations, Pollyanna, about like Change Day 2015, and part of the conversation that we've had was, you know, we learned a lot in year one of Change Day 2013, and we learned a heck of a lot more in year two, and now we're thinking about year three. So you know, in a sense, what we can't do is just take the existing system and scale it up even bigger. We've got to think about it in different ways. So tell us what you're thinking about, what the hubbies are thinking about in terms of where this might go in 2015.
Okay, so there's lots of ideas for 2015. I think on the hobbies model, what they're looking to do is expand the model, but do some really good training for people. They want to have different kinds of hobbies to support people in different ways. So we're going to have a campaign hobby where we really take the learning from being hobbies and teach people how to create campaigns about the NHS. You heard from Andy earlier, who's going to be a dementia campaign hobby. Lydia's going to take her learning around the system and trying to use those methods. Then we're going to have more regional hobbies like we did last year, but maybe a campaign region. Some hobbies have really done a good job on a tweet stuff, so they're going to spread about that. And basically, try and get as many as possible to spread that message and connect up. I think the other thing that hubbies really want to learn about this year and what they want to do is take some of those pages that people have faced and maybe had a bit of trouble delivering, and then help them learn about service improvement in their organisation and some more of the practical building blocks. Yeah. As managers and people in the NHS, you learn a lot about leadership, but it's quite challenging sometimes to learn about the building blocks of the improvement and how do you actually practically do it, because it's so different in every organisation. Yeah. So take people along that course as well, and I think a lot of it's about training and development and coaching. But it's an organic idea, and we've changed it, use the flow from the hubbies and from the new people who join in to what we do for strategy, and I think that's what will build up over time. I think what will be really exciting about Change Day next year is that we're going to have the hubby movement and all these campaigns hopefully really going around, celebrating the NHS for what it gives to us and trying to make it a better place, and connecting the senior and junior leaders together again. And I think all of that together is just going to make such an exciting 2015. Yeah,
brilliant. So, earlier on today, we talked about, some of the issues around, talked about the School for Health and Care radicals, and about how there was such a big issue around people not feeling able to make change happen and needing permission to even create very small changes. And yet when I see the way you operate and some of the other hobbies operate, and just the sheer confidence that you work with, it's like a different world. Okay, so what is it? I mean, what's the magic that makes hubbies be able to operate so much more confidently than many other people in the NHS that are like them?
I think they support each other, but they're all from different old school tribes. So through that, they have a good understanding of what they're doing and a good self-awareness and political awareness that helps them do that. They get really good coaching and support. Yeah. So they know if there's a problem, there's someone there to talk to, the senior leader, and the working between junior and senior leaders in here is really important. Junior people, we've heard through the hubbies, have so many great ideas and passions, but they still do need some senior support, some coaching to get that to work. Yeah. And I think also, the confidence comes from the fact that we've really connected with our shared values. I come to work every day, not because I want to get paid and not because of my job title. I come because I want to make a difference for patients, and that's what I want to spend my life doing and dedicated to it. All of the hubbies are the same. They're not, I'm a nurse, I'm a doctor, I'm this, I'm that. They're people who are in the NHS because they want to change it for patients, and they've got a vision and they've got a dream for the healthiest country in the world, and they want to see the best health system and the most interactive health system, because they're proud of the NHS and they're proud of England, and they're proud of the work that everyone does together, patients and staff, to deliver excellent healthcare.
I love it, honestly. So I've got time for one more question. And so, you know what, because I said I'd interview you now. So this is probably like a really mean question for 1933 at night. But anyway, so what my question is what did you hope I was going to ask you in our little interview that I didn't ask you that you'd like to say?
Right, about hobbies? That you would ask me to ask you some questions as a power balance.
Go on then.
So I would like to ask you what you think that the hubby should be doing next year to make Change Day even better.
Okay, so I think that's very good, by the way, clever. So I think that we need to kind of carry on with the spirit of the hubby. I really agree with what you're saying about the campaign hubby and the regional hubbies. I think that it's always the same. It's like any organisational system or movement, that as it gets bigger and it needs to, organise better, we start putting, there's a risk that we start putting control mechanisms in. So, which is the wrong thing to do. so like, how do we get the balance between organisation and emergence? So I think we need to think about how what are the things that maybe need to be more structural, like the training and the support, but without losing the spirit of the hubby, so that things can be done on a much bigger scale.
Okay, and how do you think we can do that?
By having lots of conversations and doing it on a kind of commitment-based approach, where we talk to all the hubbies together and work out what the right thing to do is, rather than like saying, well, this is the new hubby training program and the hubby induction, and it's kind of that it's worked on a basis of like commitment and people being able to contribute to it, and feeling very real.
Oh, well, thank you, Helen, and sorry for bringing.
I know that was mean. No, it was me. I was mean to you, and then you were mean back. So it's cool. Touché. Yeah, I know. No, that was good. I'm glad we did that. And I think Pollyanna and the hubbies, you should be so proud. And I think that what you've achieved and what you're doing isn't just about hubbies, what they achieve, but also it's such a great model for health and care in terms of that amazing kind of passion and energy that's there, and how we unleash that. And I think so many of us can learn greatly from you and the hubbies. So well done.
Thank you.
Great. So stay there, because we're going to still do some Q&A. And what I want to do now is I want to hand over to Shahid. And
hello.
Hi Shahid. Hi. Can we see you on a camera?
Oh, I wish we could, but there isn't one.
Oh, don't worry. So I'll just introduce you again, Shahid. So Shahid Sardar is Head of Patient Engagement, Patient Safety and Quality. That's a very long job title. From the Princess Alexandra Hospital, NHS Trust. Yeah, and okay, well that's well you can make sure I get it. You can correct me.
Correct it. No, I'm not interested in doing that. Okay,
I don't mind. I want to get it right. You're going to talk to us about the campaign for achieving excellence for patients and staff, and how you gain support for your campaign. So great to hear from you.
Okay, thanks, Helen. It's amazing to see so many people on the WebEx this late in the evening on a Friday afternoon, and I was just looking through the list, and there's so many people who I kind of recognize, and I think, oh my God, these people know a lot more than I do. I'm looking at Jackie Linton's on there, Mina, Addie, Pollyanna, Helen, Kathy, and I can see in the attendees Arsha, Claire, Jill, Edmar, Jill Phillips, Pip Hardy, Anna, Maria, Robin Cesaro, Jeremy Tong, Emma Donaldson, Temptation Chigova, Alex Silverstein, Helen Sanderson, John Franks, and Sebastian. And I think it's just amazing because, there is a passion out there, clearly, for quality improvement and transformation, and bringing that kind of idea of change and really, really picking it up and making it real, even on a Friday evening like this, which is just fantastic. So I was just going to talk about Princess Alexandra, who, I don't know, many of you probably have never heard of Princess Alexandra Hospital, but is a cute little hospital nestling in the kind of corner of Essex, in beautiful green Harlow. And I want to talk about what we've been doing to try and bring the kind of the passion for quality improvement, which I see every day, and I see in kind of discussions which we've just been hearing. And I've got a slightly cheeky presentation title, which I've called From Change Day Place to Social Movement in 3 Easy Steps, which, of course, is not 3 easy steps. It's a hard, long road. But we've done our best to try and move our organization from a place where we thought, nobody's really that interested in quality improvement, nobody's interested in change, to really champions everywhere. And I'll give you a quick example. Like the other day, we had our head of nursing in emergency department. She's a tough cookie, and if she's listening, she'd be laughing, I think. But she said to me, I'm just loving presenting this new plan which we've got for the multi-professional framework, which came out of the change work that we've been doing. And it just made my day, because I thought, she gets it. Wow, amazing. So if you go to the next slide, one of the things that we do at every induction is ask this slightly insane-looking question. Now, usually the whole room kind of looks at me as if I've just landed from the moon, and I probably have, so they're not wrong there. But what we're trying to get them to do, and I'm aware that this is Friday evening, so energizing everyone at a time like this is going to be difficult, but we're trying to get that energy and passion into the room. Usually we present this on a Monday morning, and they are usually fiery and quite brimming and sparky and kind of awake and kind of thinking, okay, I know how to answer this question, because they've just arrived and we're trying to introduce them to the trust. What we're essentially trying to do with that question is reconnect them with purpose. And amazingly, and I think it's testament and tribute to the people who I work with, they come back with answers like, it's reminded me about why I came to work for the NHS in the first place. And that's humbling to hear, because when we present some of the ideas which I'm going to present to you now, they're not very complicated. And I think what you've all probably heard earlier on throughout today is actually the ideas are not particularly complicated. It's about presenting them and about really going out there with a passion and saying, I believe we can do this, and we're going to do this together, and you're coming with me, as it were. And so I think that is a lot of the battle. And Helen, I've remembered so many of your presentations of you now. I'm going to have to make you cringe slightly, because one of the things I always read from some of the material you present is it's about getting the emotional impact. And that emotional impact is what we're always seeking. So going on to the next slide. What we try to remind people of is that actually, I don't think that's the next slide, but if you try again, we try to remind people of the fact that everyone has a story. We all have our own reasons why we've come into the NHS, and some of them can be very personal. Some of them are about lifelong ambition. Some of them are when I was a little wee lad or a wee girl, I would nurse my little sisters and brothers, or I would doctor, or I don't think anybody ever says I would be a manager, do they? But they say all those other things. And what we try to do is get people to reconnect with that thought. And what all of this has led to is what I describe as a multi-professional values, standards, and behaviors framework. And I'll tell you a little bit more about that further on in the slides. But it is about cutting across all of these silos in which many of us work, where individual professional frameworks, which we all sign up to and believe in, often end up doing the opposite of what we think they're intended to do, and people begin to defend their territory rather than looking across. And that's kind of, I think, one of the historic challenges of the NHS has been to cut across those boundaries. And we think we're beginning to do that with some of this work that we're describing. So if you go to the next slide, I can't really, if you click on again, I can't really, oh no, I think you have to click twice. I can't really present. Okay, we can't really present with all integrity without saying what our own backgrounds are. And so I began in mental health advocacy, and that was about seeing a group of people, which I think even now we can learn a huge amount from. The mental health user movement is, I think, one of the last great kind of struggles in terms of civil rights in our country, and their passion and ability to kind of own the issues which they have and go out there and kind of just grasp the bull by the horns and say, we're not going to take this. this is the kind of change we want. Let's see it in the law, in policy, and in reality, and in the relationships which we have with our healthcare providers. That's what really inspired me personally to kind of begin work in the patient engagement, patient involvement movement, and I guess, you know, why I've ended up in the NHS, because beginning in an organization called Mind, I decided, you know, we've got to take this and actually change. So if you click on about a couple of slides, because I'm aware that we've got a short period of time, and I can see Jackie in the window on the corner. Hello? If you click on. So, you know, and when you read the NHS Constitution, these are some of the sources of material we've used to really kind of create our social movement. Our social movement has come from, over the last year, working with 400 people, staff, patients, carers, families, telling us their stories about where their experiences have not worked. And we have used all of their words verbatim to create our value standards and behaviors framework. So if you click on a slide, another thing which we've really kind of struggled with is one particular group, which are named in this slide. I apologize in advance to any doctors out there, but we've got a very interesting, I think, particular challenge where we've eliminated essentially most of the other challenges in terms of poor quality in our national inpatient survey. You know, one of those things which we use to, you know, classically get the metrics about what's happening. But our doctors, in particular, are one of our big challenges. So one of the reasons we've introduced this cross-cutting, multi-professional framework is our doctors. So if you click on a slide, what we've been doing over the last 3 years, and this is our improvement process, is we've been whittling down that red bit of the pie chart to hopefully 0 by this year, but we've cut it in half virtually every year. So we've gone from around 18 to 10 to 5, and next year we're going to be astronomical. We're going to be off the chart. But at the moment, this is where we are. But we've been pushing hard, and this framework, these are the outcomes I think it's giving us. So if you click on another slide, we went from 665, something like that, complaints per year. It's another slide forward, to 318 the year just gone. We've virtually halved it. And from our perspective, we think this is the consequences, these are the consequences of that work that we've been doing. If you click on another slide, so a lot of that has been about recognizing, if you click on again, recognizing that actually what motivates that transformation, if you click on one more slide, is not saying we must change and improve, we must do this, we must do that. It is, if you click on one more slide, it is about actually the positive feedback. Now this is a chart showing numbers of compliments we get month on month, and that chart is now off the scale. Like 1 month recently we had 300 compliments in a month, and that for our organization, that is amazing, because if you think about, you know, the effect that has on our staff and the way they behave as a consequence, that has all come from, we think, this development work that we've been doing with them in terms of saying, well, actually, it's about you. It's about how we bring in the patient voice and really help that change happen. So if you click on 2 more slides, I'm just trying to race through because I know we've got a short period of time.
We've probably just got a couple more minutes, if that's okay.
Yeah. I've got. Okay. So if you click on again, and I think we should probably go through to slide 18. So if you keep on clicking on until you get to slide 18, I think it is. So we've involved those 400 people in the design of that value standards and behaviors framework. And we've taken it and we've turned it from that framework into something which everyone can sign up to. So if you click on a couple of slides, it'll show you the values and standards framework which we've created, and it tells you, if you step on again, the effect that it's had on people. Like I presented this last week in a group of pharmacists, and the impact it had on them. And I think it is, you know, we don't always necessarily know how we have the impact we have. So I was asking them the question, and because half the room was, you know, people were crying their eyes out after the presentation, and we think it is because simply we have tried to reconnect with that patient voice. So if you click on a couple of slides, it shows you. So this is one of the pieces of one of the materials we use, and it's from the Cleveland Clinic in the United States, one of the top 4 hospitals in the world. We looked all around the world internationally for evidence and material which we could use in our presentation of our values and standards, and this was one of the most powerful tools. So I'd encourage people to go out there and find it. And you know, it was really interesting because we presented it to a group of pharmacists in the morning. It was like 8 a.m. and they were all crying. I don't know if that was because it was early in the morning for them. And then we presented it to a group of doctors in the evening at 7 p.m. And it was really funny, the response. Well, I shouldn't say funny, but one doctor, his initial response was, "That's very impressive." And I think it spoke to the culture of our teams, and that's what we're trying to straddle. But all credit to them, they really engaged with it. This was a group of senior doctors, and they didn't cry, although I wanted them to cry, because I wanted them to get the emotional connection with the story that was being presented. So that's what we've been doing in Princess Alexandra. We think it's impactful. We think it's because we're reconnecting people with that patient voice. If you click on a few slides, it just shows you one of the last things that we do, and it shows the card. So every single person now, we've turned our pledge into something physical. So we've got every single person who signs up to the values in the organization signing this card. So this is just a picture of my card, and it says, "I take responsibility for bringing these values to life in my work." And we think that really, really works. And it's very, very symbolic and almost corny when we do it at the end. But people very, very willingly feel comfortable by the end of our discussion about how the patient voice features to sign up to that. And that's really, you know, what I wanted to talk about in this discussion. So welcome any questions, but I'm aware it's very, very late and you probably all want to go to sleep.
Yeah. No, do you know, I think that that was really, really fantastic, Sardar, and I'm just so happy that we're kind of ending the last presentation, you know, absolutely getting back to the core of why we do what we do. And you know, maybe there's not time, but maybe later on, I just think it's so interesting, you know, in terms of what you're saying compared to what Maxine and Sebastian were saying earlier. And I think it would be really fantastic at some point to, you know, to look at some of these different approaches. And maybe, you know, it's given me some ideas as well around Change Day 2015 and how we might get people together, you know, who are thinking so deeply and effectively about some of these compassion issues.
Yeah. I know it's difficult to put this across and it's, you know, Friday evening, so we're all slightly worn out and kind of like on the edge. But I really, really do believe that at the core of an effective change is that making that emotional connection and enabling people to, you know, themselves recall why they do the job and why they, you know, decide to come into work every morning.
Yeah, and if you compare that, you know, to the hubbies that Pollyanna was talking about, you know, who are a group of people who young, you know, well, a diverse group with many young leaders who are feeling really connected with their broader purpose and the energy for change that creates. You know, I think that there are some really, really important issues coming through here. And we're running out of time now, and I want us to finish at 8 o'clock after our long 12-hour slog. and I feel really bad because I think there are some people on the call, just looking at who's still with us, who would love to have this conversation. So I think what we should do, we'll just put a rain check on it, but you know, we should make sure that we do have that conversation, and that is part of what we're thinking about in the run up to Change Day 2015. So can we thank both Pollyanna and Sardar there? Can we do some electronic applauses?
It's Shahid, Helen.
Shahid, sorry.
It's
I know, I've got it the wrong way around. You know, it's on the wrong way around. Sorry, can we thank Pollyanna and Shahid? Because I've got it, it's like the version I've got here, I think it's written the wrong way around. Sorry.
Don't worry.
Yeah. Anyway, I'm going to applaud. Yeah, lots of applauses and lots of smiles. So all, you know, we're nearly there now after this crazy 12 hours. And what we just want to do to finish is just talk a little bit about, you know, what's next for Change Day. So, you know, after Change Day, we had this crazy idea of having a celebration day. And part of the reason was because, you know, on Change Day, it was very easy to talk about pledges, and people can pledge. And I think what has been so brilliant about today is just the sheer nature and depth and importance of the kinds of changes that have come as a result of Change Day. So what we just want to do now was to just kind of to finish off and move things on and talk about what's next for Change Day. And there may not be time for kind of everybody to speak, but when I look at who we've got with us still, the stalwarts, there's some fantastic people who are on the call. And what would be great is if you don't speak, can we actually put some things in the chat box so that we end up in a really good place? So yeah, the first thing to say is to thank everybody for joining us today. And we've had quite a few hundred people who've taken part at various times. And the biggest numbers were for when we had the graduation from the School for Health and Care Radicals. But really, you know, through the whole day, there's been very, very good numbers of people and great contributions. And you know, just my reflection for the day is just I don't know, the importance of the work and the extent to which what people are doing kind of shows the way forward. What I wanted to do is just get a few people to just maybe say a sentence about reflecting from the day. And I particularly wanted to ask colleagues that have been with us all day. So I wanted to ask, you know, the people that have been on since 8 o'clock this morning. So Mina and Paul and Ade and Jackie, you know, having done this crazy thing for an entire 12 hours and eaten chocolate and crisps all day, you know, what's your one sentence reflection on the day? Ade, what's yours? I hear you. Or Mina?
I can't believe that it's actually over. I feel like the time has gone by so quickly, which means it was a good day.
Yeah, fantastic. What about Paul?
Hi there.
Hi, and Ade. Ade, what?
Hello.
Yeah, Ade and Paul, in whatever order. Like, what's your sentence, Paul, in terms of a whole day?
Well, personally, for me, it was really nice to catch up with Ken, who came along with the dementia people, because I actually know him for about 20 years ago, because he's the dad of one of the someone I was at school with.
Yeah.
So I know him from before he had dementia. It's nice to see him today and reconnect with him. And because I didn't know that's what he'd come in for, I was reconnecting with him as a normal human being, not as a dementia sufferer. And it kind of reinforced the point he was making about just because you have something, that does not define who you are. Because I approached him as I knew him.
Yeah.
And that wasn't wrong. And that's the point he was making.
Yeah. Great. And Ade?
Sorry, so I had problems with the audio. Just wanted to say thanks to Shahid's presentation. That was really, really interesting.
It's brilliant,
Particularly, you know, when you think you miss France and Germany, you think that was worth that was worth hanging around for. Particularly I think what was really good about his presentation was he showed how we upscale from just sort of a small group of people to all across his organisation.
Yeah.
And I think throughout the day we've also just seen lots of interesting ways and things we can learn for 2015. So, yeah, really worth staying up for.
Yeah, brilliant. And I know there's people on the list that have been with us the whole day. I know Alex, you've been with us the whole day. It'd be lovely to hear from you or to just get a comment from you in the box. And other people, you know, that are on the call now, can you just kind of give us a quick reflection at the end of the day? Yeah, Claire's been with us a lot of the day. Jackie. So yeah, it would just be brilliant just to get some reflections. Alex, do you want to say something? Can we unmute Alex?
Hello.
Hi, Alex. Hi.
Hi. Yeah. No. Thank you so much for putting this on. It's been absolutely brilliant. I've just been very inspired the entire day. I work primarily with young volunteers, and so I do have a volunteer background, and I see a lot of similarities. And I think we talked about youth and young people earlier, and I think I'd love to help bring that as much as possible, because I think there are, you know, an army of young people that want to help make a change. And I classify a young leader as any age, but just someone that supports and believes in young people to bring a change. And I think everyone that's been on the call today has been a young leader, in my opinion.
Yeah. Brilliant. And some lovely comments as well. Emma, who's been with us a lot of the day. It's really great to hear from you, and Jill, who's been with us, and Claire. You know, it's been really, really fantastic that you've been here and been part of this. And you know, a few weeks ago, I didn't know whether this was the right thing to do or not, but we had a real sense that, you know, we needed to do more, because, you know, Change Day and pledging's fantastic, but a pledge is only a pledge. And I think that what today has shown more than anything is that, you know, that the kind of actions that are happening are just so important and so impactful and so inspiring. So, you know, really, thank you to everybody. The tweets have just been great. And again, I think we'll do Storyfy and we'll follow up. And what we're going to do is, I mean, do you want to say something about this, Mina? You know, just in terms of some of the, we're going to make some short films, aren't we, on a lot of the presentations and make them available?
Yeah, that's our plan. So we hope to download the whole WebEx on Monday or Tuesday, and then splice them all into shorter films and put them onto the Change Day website. Yeah, fantastic. Yeah. So yeah, just some data from 8 a.m. to 5 p.m. We had an average of 50 people at all times, but they were a lot of different people. We had 32 presenters. We streamed five videos, and we had a 5-person tech team behind the scenes that had been running everything from 8 a.m. to 8 p.m. And you know, it was really marvelous. And yeah, here we are at hour 12. So well done and congratulations all. And we have an announcement. Okay, so Change Day 2015 is going to be on the 11th of March. So put that one in your diary and start planning now. And yeah, we're gonna call it a day at 20:02.